Hi, I am Dr. Shamsundar, radiation oncologist from Precision Oncology Clinic. Today I'll be talking about the most common cancers in males in India. So the top three most common cancers in males is number one, head and neck cancer, number two, lung cancer, and number three, gastrointestinal cancers. Among that, esophagus is the most common. Esophagus means the food pipe cancer. So these are the three most common cancers. So there is a common culprit for all these three cancers, which is tobacco. We will go about it in detail later. First, coming to head and neck cancer. Head and neck cancer is the most common cancer in males in India, and we have the most number of head and neck cancers in the world. The head and neck cancers are again divided into two parts. One is the oral cavity cancers, where the cancer occurs in all parts of the oral cavity, mainly the tongue and the buccal mucosa, hard palate, and the soft palate, and in the neck region, which mainly consists of larynx, hypopharynx, and oropharynx. So, what are the risk factors for developing head and neck cancer? So the most common cause for developing head and neck cancer is tobacco, both smoking tobacco and non-smoking tobacco. Smoking tobacco is cigarette and BD smoking or hookah or pipe, and non-smoking tobacco is mainly chewable tobacco, either in the form of tobacco, cane, gutka, or in combination with betel leaf, that is pan. These tobacco related deaths are very high in our country. Approximately 2,500 people die of tobacco related diseases every day in our country. When we mix this tobacco with alcohol, the risk increases manifold. So the main cause of head and neck cancer is number one, tobacco, number two, alcohol. So what is the best way to avoid head and neck cancer? The best way to avoid head and neck cancer is to avoid these causative risks, mainly tobacco, alcohol, and also to maintain good oral hygiene and to immediately visit a doctor if there is any abnormality. So what are the most common abnormalities will you see, or what are the most common symptoms that you come across in head and neck cancer? The most common in oral cavity will be any ulceration or patches. These patches can be white or red. White patches are called leukoplegia, red patches are called erythroplakia. So these are the pre-malignant cancers. Pre-malignant lesions. That is, these are pre-cancerous. If not treated, can turn into cancer. So mainly, if there is any ulceration in the oral cavity which is not healing, or if there is a persistent white patch or a red patch, or if you are having any difficulty in swallowing, or if there is a change in voice and you are having weight loss. If you have any of these, please don't wait. You'll have to immediately go to a doctor and get yourselves checked. What is the importance of getting it checked early? So whenever we are able to diagnose head and neck cancer in early stage, then the cure rates are quite high. So the fire survival is about 82% if we diagnose this head and neck cancer in early stages. Once it becomes advanced, the cure rates go down tremendously to up to 25% only. So it is always better to get diagnosed early so that the treatment also can be instituted promptly. The second cancer is esophagus or GI. Esophagus, also called as food pipe cancer. So here again, the main culprit is smoking and alcohol. And also there are some literature which says that even very spicy food also can cause esophageal cancer. Here again, the main symptoms are difficulty in swallowing, persistent vomiting, and unexplained weight loss. So if any of these are present, it is always better to immediately meet a doctor. The best way to diagnose esophageal cancer is either endoscopy or a scan. Thank you.